Hi, I'm Paul Perry, and I've written 5 books with this gentleman right here. This is Dr. Raymond Moody, the man who first researched near-death experiences and named them. Raymond, what is a near-death experience?
Well, Paul, all over the world, medical doctors have determined that when patients almost die and are revived, in the course of a cardiac arrest, for example, when they come back from this, many of them will report an experience during which they seem to leave their body and go through a passageway into another realm of existence, which they say is far beyond our ability to put it into words or to describe. But they say they see a beautiful light, far brighter than anything we have ever experienced in our lives, but it doesn't hurt the eyes. As a matter of fact, in this light they feel completely comforted. They feel love that is so astounding that it's far beyond anything that we experience while we're alive. They feel almost wrapped up in this light, and they say that relatives or friends of theirs who have already died seem to be there in spirit form to meet them or to help them through this transition. And they say they see everything they've ever done in their lives in a kind of panorama. They witness everything they've ever done in an instant from the point of view of empathy with those with whom they've interacted. They say if they see themselves in this review doing a mean-spirited act to somebody else, then they feel the hurt that they brought about. Or if they see themselves doing a loving action, then they feel the good feelings they brought about.
Now, I know your work very well, and I know you started working on a field called shared death experiences.
Yes.
Which has a lot of promise in it. Can you talk about the shared death experience and what the promise of the shared death experience is?
Yes, well, to get to the promise first, what many people object about the near-death experiences is they say that, oh, this isn't an afterlife because what happens is that the oxygen flow to the brain is cut off, and so that creates a hallucinatory episode which the patient reports as a near-death experience. But a shared death experience is identically the same as a near-death experience. All those elements of the near-death experience occur also in shared death experiences. However, shared death experiences occur not to somebody who almost dies and returns, but rather bystanders at the death of someone else. That as grandma in the bed passes away, the people standing around the bed may have all these elements that we call a near-death experience. The people may say that they see the spirit of grandma leave the body and go upward. Or they may say that they themselves leave their own body and accompany the spirit of their dying grandmother part way toward this light, and then they come back. Or, incredibly, Paul, sometimes people say that the entire room changes geometry, that they no longer find themselves in the three-dimensional cubicle of a hospital room, but rather in some other kind of dimensional space that they just cannot describe. Even there are cases in which people at the bedside say that they empathically co-live the dying life review of the person who passes away. And so the bystanders, you see, are not ill or injured. There's no question of oxygen flow cut off to their brain. And yet, just by being around somebody who actually is dying, that they have these profound spiritual experiences. So what this does is that it eliminates the explanation of near-death experiences that they are caused by oxygen flow cut off to the brain.
Now, you have a personal connection with shared death experiences. You had one at the deathbed of your mother, is that right?
I did, Paul, and you got to admit that as we've been friends for 30 years now, you got to admit that my memory is better than yours, right?
Much better.
Yes. And you may not remember this, but I came out to Phoenix in about 1993 or so, and we were 4, and we were thinking of writing up a book on shared death experiences.
That's right.
We even got some names, you remember?
Sure. Yeah.
And so shortly after that, I was out in Nevada just working with some scientists and trying to figure out a way to systematically study these near-death experiences. It was in May of 1994. And on Mother's Day, when this the conference broke up, I went to the mall and I called my mother to wish her a happy Mother's Day. I asked her how she was, and she said everything was fine, except that she had broken out in a rash the day before. She went to the doctor, and the doctor said, oh, there's nothing to this, but as a precaution, he gave her an appointment to see a doctor on that following Monday, the day after I talked with her. So when I talked with her on Monday, all was well. She went to the doctor next day, and he said, you have non-Hodgkin's lymphoma, and you have 2 days to 2 weeks to live. So Cheryl and I, my wife and I, went to the place where my mother was in the hospital, and we stayed with her the entire 2 weeks. She did die 2 weeks later to the day, and when she did, my wife and I and my brother and sister had this very profound shared death experience. And paradoxically, that sort of diffused my curiosity.
Yeah, I
was
noticed
very
that.
curious.
Yeah.
And so then I just, since it happened to me, I couldn't get up the oomph to study it, because my curiosity to a degree had been satisfied. But cases kept accumulating, and then a couple of years ago, you and I wrote Glimpses of Eternity, which is about these shared death experiences.
So did having a shared death experience make you feel less like a bystander and more like a participant in the whole field,
you're absolutely
in the whole
right.
field that you created? Because you created the field of near-death studies.
Well,
You named the near-death experience.
Yeah, with all deference to Plato, but you know, who studied it too. But yeah, and I guess it did. I mean, I guess you know, the fact that I was able to maintain a certain distance on this, I think was what was enabled me to be a good researcher.
Sure.
But once I had my own experience, I suppose deep down I felt that I couldn't maintain that distance on the shared death experience anymore.
But I've noticed after you had the shared death experience, there's been a change in your attitude towards the question, is there life after death?
Yeah.
What do you now think? Do you now think there's life after death? Are you ready to say yes?
Yeah, I do. My assessment is yes, there is life after death. Because a couple of years ago, I encountered a case where an artist was severely injured in a wreck, and he lost his wife in the wreck, and he had a very profound near-death experience. And so he wrote this up, and then he saw that in his writing of it he had mentioned the name of the surgeon who saved his life. And typically, by the way, people with near-death experiences don't tell their doctors.
Right.
So then he thought, well, you know, I really should tell the doctor about this, because if he sees his name in a book and I don't tell him. So he called the doctor and invited him to lunch, and when the doctor came, he told him the near-death experience he had had during the surgery, whereupon the surgeon became solemn and said, well, I've not told anybody this, but that night you were in the hospital, I knew you weren't going to die because I talked to your wife. And she was communicating, although dead, his dead wife, and she was communicating with the surgeon during the procedure. And then as this went on, the nurse in the procedure piped up and said, yeah, well, me too. So at that point I thought, well, you know, I felt myself trying to rationalize and run away when I tried to come up with some other scenario that explains this. I mean, it's logically possible to look at that and say that at the same time the patient was having a near-death experience due to physiological distress and the oxygen flow and so on,
Right.
that the nurse and doctor were having a joint psychotic episode.
break, yeah.
But you know, that's just not, it's not plausible
Yeah.
to me. To me, it seems the simplest thing to go on to say
Yeah.
that in my assessment, yeah, there is life after death.
Okay. So one last question. On a scale of 1 to 10,
Mm-hmm.
10 for life after death,
Mm-hmm.
8, what?
Probably in the range of 8 to 9 now. It's my policy to maintain doubt about everything. The only things I can't doubt is, for example, that I love my kids and my family and my friends. That one I don't doubt. But most other things, you know, it's so I don't know. To me, it's like I would say I'm more toward the 90% or more toward the 9 confidence level that, yeah, there's an afterlife.
All right.